Most people during their teenage years have experienced acne to some degree. Knowing what causes the condition and learning how to treat it can minimize the occurrence and clear up the problem. We spoke with Dr. Gene Rubinstein at the Dermatology and Laser Center in Studio City to find out about the best methods for treating this condition.
Acne is caused by overproduction of sebum in the skin. Sebum is oil, and when it's overproduced, such as during the hormonal spurt in teenagehood, it clogs up the hair follicles and it causes pimples to form. Acne is treated in a number of ways. The first is topical treatment with things like retinoids, like Retin-A, with things like topical antibiotics. The second is oral antibiotics. The third, which is the newest way to treat acne, is with laser treatment combined with PDT, or photodynamic therapy. Photodynamic therapy is a two-step process. The first involves a medicine called Levulan, which is soaked into the skin and goes into the sebaceous glands, which cause acne in the first place. The second is the activation of the Levulan by light. Different light sources are used, including blue light, something called V-beam, and IPL, intense pulse light. One of my patients presented to me when she was 16 years old. She had severe acne, which was scarring. We decided to use Levulan with PDT. She had 3 treatments, 1 month apart, and she did magnificently. There are definitely 2 phases to the treatment. The first is getting rid of the acne. In her case, my patient can expect an 80% reduction or more of acne for probably the rest of her life with the treatment. But now we have to take care of the scars. The scar treatment is performed with something called Fraxel laser. We do 5 treatments, 1 month apart, and we expect to see an improvement of 50 to 70% in the scars. The Fraxel laser is made by a company called Reliant. It's a unique product. Fraxel is a laser treatment which involves resurfacing the top layer of the skin. It's a unique treatment because it doesn't resurface the entire surface at one time, it resurfaces partially. It puts in little pixels of light called microthermal zones, and it creates collagen remodeling within the dermis. That remodeling then fills in the scars from underneath. It can take up to 8-9 months to get rid of the acne and also get rid of the acne scars. In addition, even after the Fraxel treatment, there is additional remodeling of the skin and of the dermis, and there's still improvement even after the Fraxel treatment is performed. It's extremely rewarding to see people before and how they had to deal with rejection, how they felt, and how they felt that people were looking at them, and to see them afterwards, and they're totally different. They feel better about themselves. Oftentimes they start to work out, they start to interact socially, they get married, so all kinds of things happen.